different manifestations of tuberculosis. Good evening, Dr. Mukesh ji. Okay, right. So we'll see here tuberculosis. Tuberculosis को क्या बुलाते हैं? किंग्स ईविल या व्हाइट प्लेग. ये पुराने समय के नाम रखे हुए हैं, राइट. जब tuberculosis इतनी सारा कॉमन नहीं थी, एकदम नई नई ताजी ताजी बीमारी थी. Before the antibiotic era, it used to kill many of the people. That is why the name was given King's Evil or White Man's Plague, right? Okay. Now, tuberculosis of the spine, इसका नाम क्या रहेगा? This is called as pot disease. Tuberculosis of the fingers, it is called as spina ventosa. Tuberculosis of the shoulders, this is called as caries sicca. Whereas pulmonary tuberculosis, it is called as pox disease. Pox disease. And the most common type of tuberculosis is pulmonary tuberculosis. And the second most common type is the tuberculosis which affect the lymph nodes. And which lymph nodes are commonly affected? Jugulo-digastric lymph nodes are the lymph nodes which are commonly affected. Now, third most common type, in some books it is mentioned as genitourinary or skeletal type of tuberculosis. Since we are not studying surgery as of now, we'll focus ourselves to skeletal tuberculosis. In skeletal tuberculosis, what is the most common site? Dorso-lumbar junction. Dorso-lumbar junction. That means the junction of thoracic spine and the junction of lumbar spine. T11, T12 and L1 vertebrae. So these are the common sites. These are the common sites of tuberculosis. This is where the tuberculosis commonly affects. Tuberculosis commonly affects. Now, tuberculosis, it is seen commonly at the anterior aspect. अगर anterior में tuberculosis है, so what do we get at the posterior aspect? At the posterior aspect of spine, we get to see secondary tumors. We get to see secondary tumors, right? Now, what is the most common pattern in tuberculosis? Most common pattern in tuberculosis is peridiscal. Peridiscal means around intervertebral disc. Intervertebral disc. Now, this occurs if the disease reaches spine by arteries. If disease reaches spine by arteries. Second most common is central. This occurs when the disease reaches by veins. What are the veins? Batson plexus. Third most common type is anterior subperiosteal. Periosteum के नीचे. Anterior subperiosteal. Right? Least common is the facet joint. Facet joint and the spinous process. If you remember your anatomy well, remember they both are present at the posterior aspect. Spine में ये थोड़ा पीछे करके पड़े होते हैं दोनों ही, facet joint भी और spinous process. Facet joint भी और spinous process. आपने बहुत बड़े टीचर हैं अब्बास अली साहब, उनसे पढ़ी हुई है ऑर्थोपेडिक्स. में जस्ट क्विक रिविजन करा रहा हूं. आप देखिए इसमें क्या है. क्लिनिकल फीचर. व्हाट आर द क्लिनिकल फीचर? फॉर एग्जांपल, आपके मरीज का हो गया जी एक्सीडेंट. एक्सीडेंट के एकदम बाद से उसको कमर में तेज दर्द उठा. योर पेशेंट हैज बैक पेन इमीडिएटली आफ्टर एक्सीडेंट. इज दैट काइंड ऑफ बैक पेन, acute onset back pain. But here pain will be insidious. deciduous का क्या मतलब हुआ? Deciduous means gradual onset back pain. Gradual onset back pain. You ask the patient to do twisting motion, there will be pain. This is called as twist tenderness. Twist tenderness. में करना क्या है? जमीन पे एक कॉइन गिराइए. Ask your patient to pick it up. Drop a coin and ask your patient to pick it up. So your patient does not bend the spine. Your patient does not bend the spine while picking objects from the floor. This is called as coin test. Called as coin test. Earliest neurological sign is clonus, like this. Repetitive, jerky movements. This occurs due to increased deep tendon plexus. Now, when the disease progresses, जब आपके मरीज की बीमारी थोड़ा बढ़ गई, patient will develop paraplegia. That means kind of paralysis. Now, it is of two types: early onset and late onset. अर्ली ऑनसेट क्यों होता है? अर्ली ऑनसेट होगा ड्यू टू प्रेशर ऑफ पस ऑन द स्पाइनल कॉर्ड. लेट ऑनसेट क्यों होगा? ड्यू टू फ्रैक्चर ऑफ स्पाइनल कॉर्ड. उधर थोड़ी जगह कम थी तो इसलिए एससी लिख दिया, इधर पूरा लिख दिया स्पाइनल कॉर्ड. दिस हैज गुड प्रोग्नोसिस. फाइन. Why? Because it simply reverses with removal of पस. आपने पस निकाला, आपका मरीज उठ खड़ा होगा. Late onset. Now this has got poor prognosis. फ्रैक्चर ही जब हो गया तो अब आपके मरीज की स्पाइनल कॉर्ड कहां से ठीक हो? राइट. इन्वेस्टिगेशन ऑफ चॉइस क्या रहेगी? एमआरआई. इट विल शो क्विक रिजल्ट्स. फटाफट से आपको पता लग जाएगा क्या प्रॉब्लम है आपके मरीज. गोल्ड स्टैंडर्ड इन्वेस्टिगेशन क्या रहेगी? कल्चर ऑफ माइकोबैक्टीरिया फ्रॉम द पस. कल्चर ऑफ माइकोबैक्टीरिया फ्रॉम द पस. एक्सरे पे जो अर्लीस्ट चेंज हमें नजर आएगी, व्हाट अर्लीस्ट चेंज? यू गेट टू सी लॉस ऑफ कर्वेचर. लॉस ऑफ कर्वेचर ऑफ द स्पाइन. लॉस ऑफ कर्वेचर ऑफ द स्पाइन. ये इसलिए कि स्पाइनल कॉर्ड वर्टिब्रल कॉलम के आसपास जितने मसल्स हैं वो पस के कारण चले जाएंगे स्पाज्म में. गो इनटू स्पाज्म. Muscles around the vertebral column, they will go into spasm. Now, I'm here in Amritsar, and you see Guru Nanak Dev Ji, revered, saintly Shri Guru Nanak Dev Ji. His birthday is being celebrated here, so you get to see loud sounds, and you get to hear loud sounds. My regrets for that. Right now, in see. In advanced tuberculosis, you get to see cold abscess, and then you get to see calcification of paraspinal abscess, which is also called as bird nest abscess, Now, this is said to be pathognomic of tuberculosis. मतलब अगर आपने पैरास्पाइनल एब्सेस का कैल्सिफिकेशन देख लिया, किसी और टेस्ट की जरूरत नहीं, लिख के ले लो कि आपके मरीज को ट्यूबरकुलोसिस ही है. राइट. नाउ, इन ट्यूमर्स, इफ योर पेशेंट हैज गॉट ट्यूमर्स अफेक्टिंग द स्पाइन, फाइन, IVD, intervertebral disc, is preserved, whereas in tuberculosis, intervertebral